When placing elastics to the loop on the arch wire, the entire segment will retract. As previously mentioned, this application is best in minimum to moderate anchorage cases. Extraction space closure should be approximately 1 millimeter per month, measured at the distal end of the molar tube. If more than 1 millimeter is present, then a tipping of the anterior segment is going to be prevalent. Each month, be sure to check the amount of arch wire that has been extruded out the distal end. This will give you a feel for the amount of extraction space closed during that month. As an alternative, elastics may also be placed onto Kobayashi hooks or in the POS prescription system onto ball hooks already placed in the cuspid brackets. The cuspid is not chained or ligated to the remaining anterior teeth. Then the cuspid will be retracted by itself along the arch wire, leaving the incisors to be retracted at a later date. An anterior cross elastic is used to correct midline deviations when one cuspid is tight in occlusion and the other cuspid has excessive horizontal overjet. Here the elastic is placed between a Kobayashi hook and the ball hook on the lower, whereas a Kobayashi hook is the only way that you can do this with the plastic brackets. With the metal brackets you can use a ball hook. A posterior cross elastic is placed between lingual cleats of the molars. You merely bend out the lingual cleats and place the elastic from the lingual of the molar to the buccal attachment on the opposing molar. In this case, you can see that the lower molars need uprighting and buccal crown torque. Arch expansion or arch constriction can be accomplished using posterior cross elastic and is used primarily for arch coordination in the finishing stage. It is difficult for the patient to find the attachment for the elastic back that far into the mouth. And there are times where the elastic will not stay on the buccal attachment. In these cases, you will need to bend the buccal hook up on the molar band. An elastic attachment instrument can be purchased from a Progressive Dental Supply and is helpful for your patients in placing elastics, especially in these types of applications with the posterior cross elastics.